RxKids is continuing to be a scam.
Michigan Speaker Matt Hall calling out the state's prenatal and infant cash prescription program. The RxKids program launched in Flint in 2024. It has since expanded across the state and has enrolled nearly 6,000 families. Speaker Hall was very critical of the program. RxKids is through Michigan State University and administered by GiveDirectly, a nonprofit organization based in New York. The last state budget provided $270 million to MSU to support RxKids.
We're not going to support more funding for RxKids in the budget.
Republican House Speaker Matt Hall says they are looking into the program, which he calls a scam.
I really think we should look at Michigan State University carefully at this. They're administering the program. And really what we're seeing is this program is it's a bunch of left-wing groups, Soros-backed groups.
The program is funded through the state budget that was passed last October. As of February 10th, they've distributed a little more than $24 million. Democratic State Senator John Cherry says the money is matched by private donations.
With our state dollars, we are leveraging many philanthropic dollars. But when you're talking about the Mott Foundation, I don't think there's anything scary there. They've been helping kids in Michigan and Flint for years.
RxKids lists donor organizations on their website. Money comes in from various groups across the state. Along with Hall calling out the funding sources, he says the money is just handed to people.
That's why the traditional cash welfare programs ensure, number one, there's an income need, and then they try to structure it toward approved items, food, formula, diapers, things like that.
According to the website, RxKids is open to women who are at least 16 plus weeks pregnant and living in communities where the program has launched. There are no income or work requirements. It focuses on supporting families during pregnancy and the baby's first months.
RxKids, it's a program that provides support to pregnant mothers and babies, and it is the furthest thing from a scam. We're reducing expenses by more than the money we're putting out the door, just when you look at NICU visits. So that's not talking about the long-term benefits they're going to be for development for kids and maternal health outcomes and all that.
The way the program works, moms get $1,500 during pregnancy and babies get $500 a month for a designated length of time between 6 and 12 months. I did reach out to see if someone from Michigan State University who leads this program was available for an interview this afternoon, but did not hear back.